Now's the time to pause the video, run to your kitchen, and grab a macaroni noodle. All right, have you got your noodle? Okay, feel it. Move it around in your hands. What do you notice about this noodle? It's hard, it's firm, that it's curved. Okay, all of these things are great observations. This is meant to represent so many laboring women. Our muscles are firm and tense. We are curved over in the fetal position, or sometimes we're hyperextended. But whatever we're doing all that we can to tense our muscles and the attempt to decrease the sensation we're feeling, and there's one really big muscle, our uterus. All right, this is a less effective way to cope with labor. So I want you to put down your macaroni noodle, and I want you to close your eyes. Envision cooked angel hair pasta. All right, do you think you might be ready to go ahead and try this at home? Okay, moms and partners, I want both of you to try this. And partners, it's so important that you learn how to do all of the breathing techniques along with mom, because she might come to a point in labor where she is just not able to do it alone. And so you need to be able to do it so that she can mimic you and you can work her through those contractions. So I want you to practice the breathing techniques together. All right. Uncross your legs, put anything down that you might be holding on to. Get comfortable. Find your focal point. What do you think you're going to look at? And contraction begins. Take that cleansing breath. And out. As that breath goes out, tell your body to go limp. Get relaxed. You're on your focal point. At the beginning of active labor, we most likely describe our contractions as moderate, and as active labor progresses, we describe them as strong. Now, they might be coming every 10 minutes, every 5 minutes. They might get as close to every 2 to 3 minutes. They're lasting between 40 and 60 seconds. How long does this last? Well, it lasts about 4.5 hours, give or take, on a first-time mom, around 2.5 hours, give or take, for a woman who's given birth before. The cervix is dilating between maybe 6 to 8 centimeters. In context of the length and intensity of these kinds of contractions that we experience in active labor, what do you think are some common emotional responses from women? Mom, how do you think you'll be? Partners, any guesses? A very common emotional response to active labor is that women turn more inward. Where maybe we were chipper and talkative and excited in early labor, we start to see that women become more quiet, more focused, more withdrawn as they work to process the physical experience of these contractions. I want you all to give me your very best girly pain sounds. Okay, do it with me. And as you do, put your hands on your abdomen. Partners, you too. Okay, ready? Oh, hee, oh. What are those sounds doing to your muscles? Do you feel it? Absolutely, they're causing tension. When we make those high-pitched sounds, our muscles are tensing up. Partners, if you start to hear those sounds, it's a pretty good indication that mom is not coping positively. Maybe that she's even starting to suffer. So we want to discourage these high-pitched girly sounds during labor, and we want to bring it to a whole new level. Let's step it down a notch. Think low, loose, limp, long. Think manly. If it helps you, think barnyard. Right? Some of the sounds that we make in labor kind of sound a lot like cows. And that's okay, right? We can have a sense of humor. We can laugh about these things. But these sounds are so effective when we're laboring. The hands and knees position is a really valuable one when we're experiencing back pain in labor because it can help facilitate the rotation of the baby to an anterior position. Additionally, when we get in this position, the weight of the baby's head that used to be centered on our lower back now slips into our abdomen, and we see a pretty significant decrease in that back pain. But this can be hard to hold and maintain for long periods of time. So Seth is going to come with that birth ball and demonstrate how we can use the hands and knees position with the birth ball. Thank you. And he's also going to demonstrate how to apply counter pressure when mom is on the birth ball. The thing to remember, partners, is that when you push on her lower back to do the counter pressure and she's on a ball, you might just accidentally push her away. So you do what Seth was doing by holding onto her hip. And let's contrast this with peeling an overripe banana. Gosh, you pick it up and the thing just falls apart. The peel practically falls off. Now this is a very good comparison to a cervix that is ready to go into labor versus a cervix that is not ready to go into labor. Actually, the true medical term that we use to describe a cervix that is ready to go into labor is ripe. Let's think about the characteristics of a ripe piece of fruit. It's soft, right? Well, so is a cervix that's ready to go into labor versus a piece of fruit that is unripe, that is very firm. And a cervix that is not ready to go into labor is also very firm. So this idea of waiting until our cervix is nice and ripe before we go into labor is very important, especially under the context of starting an induction. Your healthcare provider will be checking your cervix prior to an induction to make sure that it is ripe and ready to go into labor. A cervix that is not ripe will not respond favorably, typically, to a Pitocin induction. It might not cause contractions that bring about effacement and dilation of the cervix, in the same way that we might attempt to peel the green banana, but it doesn't mean we're going to get the peel off. Let's say now that you are in active labor, things are progressing, moving along, so you get admitted to the labor delivery unit. The first thing to happen when you get on the unit typically is they're going to check your vital signs. After they do that, most facilities are going to want to start an IV. Now, if you are really not interested in having an IV, then discuss this with your healthcare provider. But most facilities require it kind of as standard care. And once they start that IV, they're usually going to take some blood to run a CBC or complete blood count. When they do this, they're looking for your blood type, and they're also checking out your platelets to make sure that you have enough platelets for clotting in case there was any bleeding. Let's go back now and discuss this IV just a little bit more. Have you ever had an IV before? All right, let's talk about how this is done and what this means. An IV is typically placed in a hospital setting so that they have access to your veins in case you need fluid or you need medication.
I can do anything. I can reach any goal today. I can do what I want. I can be what I want to be.
It's now around 8:30 a.m. I've asked to have my cervix checked, so the nurse in the corner is waiting until my contraction ends to check me. These are long contractions now, and they feel almost back to back. Seth keeps trying to encourage me to change positions, but I'm being stubborn and don't really want to move off the ball. Every time I do, those contractions get more intense. Can you blame me?
Take a deep breath in, filling your lungs with oxygen. Slow.